So I'm just going to start with a couple of overview slides. So small cell carcinoma of the ovary hypercalcemic type, or SCOOT, as I heard Bernard call it this morning, which I think is quite a good name, so I might use that. Was first described by Robert Scully, who's a very eminent pathologist, back in 1979. So it's not been known about that long, essentially. And as we all know, it's a very rare condition, and that's really one of the reasons why progress has taken time, because it's a rare condition. And I think we can use SCOOT as a paradigm to study other rare tumour types. And I think that's another, one agenda is to focus on the cancer itself, but another agenda is to think about how we can use what we're doing here to parallel out to other types of rare ovarian cancers and other cancers indeed. So we know that this condition affects predominantly young women, and that makes it particularly devastating. There is quite an age range, but the average age is around 25. And it's an aggressive cancer with, and we know that in general the prognosis is quite poor compared to other types of cancer. And these are the real challenges that face us. So not only is it rare, but it's an aggressive type, which means that typically researchers need patients to study to drive the disease, to push the field forward. And if it's rare and it's associated with a poor prognosis, it makes it logistically very difficult to actually get enough data to actually investigate the condition properly. And that's why we also need to do this at a global level. There's no point in just doing this in one country or even one continent. Whatever we do really needs to be done across the world. And these days that's quite possible to do. So I think the timing is perfect for this. In terms of what how this condition presents, well, normally in the majority of cases it presents with hypercalcemia, and plus you can get other symptoms of more common ovarian cancers. And it can grow to quite a large size, so you can get symptoms of pressure symptoms, for example, and that's how it may present, but by then it's already often at an advanced stage. And treatments are often very aggressive, so aggressive chemotherapy combinations and usual combinations of surgery, aggressive chemotherapy and radiotherapy. And here are some data which just show again the average age of the ovarian cancer condition here. So you can see that the mean age is mid-20s, so that's why it makes it particularly devastating, and also the overall survival time as well. It shows quite a steep curve, and these are the challenges that we face. These are the things that we need to change. And so the condition was identified first in 1979, and it was very much a niche area, only known to a few pathologists throughout the world, and it remained very much off the radar. But things changed dramatically in 2014. There was a huge breakthrough with several groups simultaneously publishing data showing that there is a clear genetic cause for small cell carcinoma of the ovary, and this is due to the gene called SMARCA4, and this was a huge breakthrough essentially, and it's really set the whole field alight, and this is really one of the reasons why we're here today, because now we can see much more about the etiology of the condition, and because we know that, we can start thinking about targeted therapies and move on from there. So this really has provided a major impetus to the field. So I think before 2014, very little happened. Since then, there's been a whole flurry of activity. So I think one can be really optimistic about this. So this gene is actually inactivated in most cases of small cell ovarian cancer, and it's involved in the SWE/SNF chromatin remodeling complex. This is a very fundamental process within the cell, and interestingly, this is really the only genetic factor associated with this tumour type, and it has been known around a while, because there's another similar tumour type, very similar tumour type, which has been known to the paediatric neurogenetic community, called atypical teratoid rhabdoid tumour. And this is something we're going to hear about later on as well. And importantly, this small cell ovarian cancer hypercalcemic type is not related to other tumours called small cell carcinoma. So I think that's an important point to make. So in the somatic situation, the vast majority of small cell ovarian types are inactivated in SMARCA4, but also you have a surprisingly high number of germline mutations in this condition as well. And that is another big clue about this genetic homogeneity of this condition, which again provides us with a lot of opportunity to think about targeted treatment. Because this is quite unusual compared to other types of ovarian cancer and other cancer types in general. So in Cambridge, we set up a small cell ovarian cancer project, and the idea is really this is really a supportive type of project to foster collaborations, develop and develop a patient registry. And we've set up a website. We've had quite a reasonable number of visits, and we've also had quite a large number of patient or disease-related queries, and these come from all over the world. And we also have been able to recruit patients to develop a database, and so we can facilitate research. And this is something that I think we need to do at a global level, and it's important that we have a good profile by doing this sort of thing. So the goal of this is really to develop a national and international registry and to establish cohorts. So it's really to provide a foundation to provide resources and support for patients as well, and really to create dialogue between clinicians and scientists who are involved. And that's why that's one of the reasons why we're all here today as well, and to provide the foundations for targeted treatments as well. So these are the key goals of the project. And we've been very fortunate that we've been able to work closely together with Maren Pettersson, who's set up the Small Cell Ovarian Cancer Foundation in Utah. Now she deserves special credit because she set this up, and her family set this up a long time ago, and it's been a wonderful experience to work together with her, and we hope that this will carry on in the future. And I'm very pleased that she's here today, and that her family are here and been able to join us for this special day. So what are the problems that we face? Well, it's a rare cancer. We have problems predicting the outcomes. The diagnosis is challenging. Treatment strategies are unclear. We have there's a lack of large cohorts of patients as well, and tumour markers are non-informative. So we have a huge, uphill battle here on our hands. And this is a quote that we think is down to Glenn. We're not entirely sure. But the rarity means that most specialist practitioners will see one such case every several years, and most may never see a case. And I think that really highlights the problem that we have. So, and even though it's rare, it is a vitally important tumour type that we need to really address and work together on to develop further. So I'd like to just acknowledge some important people who've made this all possible today. So I'd like to thank in particular the Eva Peel, and Athena's here at the back, who's the CEO of the Eva Peel. She'll be around today. So through her, we've been able to actually arrange today and set this project up. And a lot of this initially came about through a contact between the Eva Peel and the Butcher family, who came to visit us in Cambridge and really set the ball rolling. This was a couple of years ago now, and this was in memory of of Angela Butcher, and we had a lovely day, and we discussed what we'd like to do, and this is very much they initially initiated this for us through the Eva Peel. We also have Matt and Emma here as well, and I'd like to thank them. They've also been incredibly helpful, and also the Bridge Mattresses as well. So thank you very much for all your support. And I've thanked Maren. Will's also been incredibly helpful in giving us some guidance here. And I'd also like to thank Tim Mould, who is the organiser of the whole conference here today, for facilitating this satellite meeting. And last but not least, I'd like to thank Inga at the back there, who spent a lot of time and hard work organising everything. She's recently moved on to pastures new, but she's maintaining a strong interest in this field, and she's around today for to discuss this further. So what is the purpose of today's symposium? Well, I think these are really the main points. So to educate each other, to collaborate, to build new ideas, to work together. And ultimately what we really want to do is to find cures and also to prevent the condition arising in families that are at high risk. So these are really the key aspects that we're going to focus on today. So I'd like to finish there. We won't take any questions. I think we'll move straight on to the next speaker.